You're way social distancing.
Let me turn the mic. There I go.
Good evening, everyone. I think we are all present now, Mayor, and we are actually live.
All right. Well, good evening and welcome to the City Council Special Session Meeting of June 30th, 2020. Madam Clerk, will you please call the roll?
One moment, Mayor, something's double.
I think I know what happened. That's what happened.
Oh yeah, I was getting my feed from the. Okay, my apologies. Councilmember Bierman,
Here.
Councilmember Carter,
Here.
Councilmember Patron,
Here.
Councilmember Hall,
Here.
Councilmember Wilson,
Here.
Councilmember Scanlon,
Here.
Councilmember Holman,
Here.
Councilmember Scott,
Here.
Mayor Clark.
Here.
Okay.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Well, to our first item on the agenda tonight is an update on COVID-19. I think no one is unaware of the spike going on around the nation, but also right here in our community. So it is time to have very important conversations about our next steps, as the status quo clearly isn't going to work, especially as a college town. If we are wanting to bring back thousands of young people to our community, many coming from the great state of Texas, which is seeing one of the greatest outbreaks in the nation. So with that, we have invited several speakers to provide us with helpful information to guide our decision making. And I think we're going to start with Ms. Jackie Knack from the Cleveland County Health Department.
Good afternoon, everybody. Can you hear me okay?
Yes, ma'am.
Mm-hmm.
Okay, perfect. So I'm just going to share a little bit of information with you guys. I chose to look at a 14-day snapshot of the data we have because that would be the most helpful. Within the last 14 days, we have 213 active cases. That's basically the daily average. The highest age range that we're seeing is 18 to 35 years old, with almost 47% of the cases. If we want to go from 0 to 35, then that actually covers 58.2% of the cases. And if we want to go 0 to 49 years old, that actually covers 73.7% of the cases in the last 14 days that have come about. So, but again, just want to point out that highest age bracket, that 18 to 35 years old, is the highest percentage we're seeing at 46.9%. Something interesting about Norman specifically is what we're seeing in our district and even across the state is big groups like pool parties, just parties at home, weddings, funerals, church services. We're seeing a lot of outbreaks in those types of situations. Norman specifically, we're not really seeing any super spreader type of event or source, which just means that in general, it's community spread. We're not seeing a certain group that's joining in with another group and just spreading it everywhere. So I thought that was very interesting for Norman specifically. We have 700 trained contact tracers at the state level. We have 11 strike teams available when a hotspot is identified. So, for example, in another region of the state, there's a Tyson chicken plant, and that was considered a hotspot when several cases came about at once. So those strike teams were sent out to test everybody and kind of monitor that situation. So we have 11 strike teams available to do that. We have free testing statewide at over 80 different pods or facilities. And we have the state's PPE supply, which is very well stocked. And then just a little bit of information for you as well. We had our pod last week in Norman. We had out of 633 total cases, 633 total tests, we had 71 total positives. Out of those total positives, 25 of them were from Cleveland County. So, and I'm going to open my email because I had my staff going back. We were finally able to touch base with every single case, aside from just a handful that weren't answering their phones yet. And out of all of those numbers, let's see, 376 out of that 633 we tested were actually Cleveland County, and those were all negative results.
So I'm going to ask a quick question based on that. We saw quite a spike in our numbers. I believe it was Saturday. And so if that big testing pod on Thursday, because I actually went through it, very well organized, if I may say so. And I tested negative for everyone who's curious. And it is uncomfortable. I want you to know that. So it's right there. It should be an incentive to not hang out in large crowds. But we were wondering if the biggest numbers we've seen, I believe, since we've been keeping track of daily numbers, we thought we could attribute to that testing pod. So from what I'm hearing is that is not accurate.
It's really not. We're seeing an average of 23 new cases a day, which seems kind of weird because our total number of average active cases in a 14-day snapshot is 213. But as cases fall off, because they've been through their time period and cases fall off, we're still picking up positive cases. So over the last 14 days, we've averaged about 23 new cases a day. So we did do testing in Moore as well, in Moore that same day that we did our pod. So we did have some additional testing on top of that 633, but we got test results mostly on Friday, which would have been reported on Saturday. So a lot of those positives you would have seen on Saturday for sure, but they didn't all come from the pod.
Okay, but some did.
Yeah, some did for sure.
Okay.
All 20. Yeah.
Question about community spread. If you could explain that a little bit more for those who are watching and may not understand it. We're all learning a lot about pandemics and epidemiology through all of this. So could you just briefly describe what a super spreader is and what community spread means for the 14-day outlook?
Yeah, absolutely. So community spread is basically when there's no absolute source for spreading. So we can't attribute it to a actual wedding or a funeral of a positive case that has spread it to everybody. We just can't trace it back to a specific person. So it might be that they went to some type of event and they don't know who all they were around, but then they started having symptoms and they were tested, or we're seeing some asymptomatic cases that are just going to a sport camp or something like that, and they are required to have a test. And we're seeing some asymptomatic people like that. They have no symptoms whatsoever. They had to be tested and came back positive. And most likely they're around people that they don't even realize that they're positive themselves. So that's community spread, when people are just out and about in community activities. They don't know who exactly they've been around. They don't know where they could have gotten it. A super spreader.
Go ahead.
Uh-huh. Yeah,
I was
so
just going to say, it's like,
go ahead.
it's like where you see these headlines where 12 of an 18-person family birthday party tests positive.
Yes. Yes, exactly. Or a big event where, so many people tested positive, or a couple of them tested positive, and then before you know it, we have a whole huge group that has tested positive out of that one event or something like that. Yes.
So we just don't know where it is in Norman, unfortunately.
Yeah, it's just everywhere in Norman. We do have an option to pull some data by zip code, but it is really, it is not very helpful. It doesn't really give us much information, but I can tell you that 73072 is the zip code with the highest positive case count. But beyond that, we don't have a lot of information. We don't know where it came from to spread it in that zip code versus any other zip code or anything like that. So to me, it wasn't as helpful as just knowing that, it's out there. We can't trace it back to a specific source every single time. Like I said, within our district and even within the state, we are seeing higher numbers in churches and just any type of social gathering, which makes sense. If somebody doesn't know they're positive and they're around other people and hugging and, sharing food, that type of thing, that's what happened. So.
Thank you. And I know that you have to leave at 6. So council members, does anyone else have any questions for Councilmember Bierman?
So I have a question about wait times for testing in Norman, because I've gotten some calls from people who have been feeling like they couldn't wait for over the weekend in order to get in at the health department, and then they try and go to an urgent care facility, and urgent cares are charging a $60 urgent care fee to get tested. And so that aside, because that's something that I would like to try and figure out on a different level, but that aside, what are we kind of looking at in terms of wait times to get an appointment for testing in Norman specifically?
Yeah. So up until about a week ago, you were able to get an appointment same day or next day. This week has been insane. We tested 65 today in Norman and almost 90 in Moore, and we're booked out like that for the rest of the week. The heat makes it difficult because we're in full PPE, and just the amount of staff we have, we're trying to rotate out so that we don't get them overheated. It is very, very, very hot in full PPE garb in this type of weather. But we literally are testing, we're double booking every 5 minutes throughout the morning, and then trying to add on as we can. We also are keeping up some services within our health department. So right now, currently, we are booked in Norman through the rest of the week, but I've reached out to the state health department, and we are looking at different options because the pods are difficult because it pulls so much of our staff from all of our areas, and all of our areas are getting hit very hard with everybody wants to be tested now. So we don't want to pull from other areas to do that, but we are looking at hopefully bringing some more nurses down from the state office to be able to either triple or quadruple book every 5 minutes at our Norman and Moore locations. So they're working on that right now. I'm hoping to hear that they have a solution for us in the morning, but most likely it won't take place until Monday.
And I'm really glad to hear that you're working on kind of expanding your capacity, because it does concern me that if people's financial limitations mean that they can only get tested at the county health department and they can't get paid time off until they get a test, it kind of creates an untenable situation, especially for a lot of people in my ward. So I'm glad to know that you're working really hard to expand your testing capability. Not just the test, but the hands to actually administer them. Because as I've been told, if it's not uncomfortable, then it's not being done right. So I'm glad to know that
Unfortunately, that is true.
Yeah. So I really appreciate that. So that's all the questions that I have. Thanks.
Oh, you're welcome.
Any other questions from council for our very hardworking partner? Thank you, Jackie, for all that you've been doing at the Cleveland County Health Department.
I'm not seeing any, Mayor.
All right. Well, thank you so much for your time tonight. And again, I continue to appreciate your participation in our weekly emergency management calls. And those certainly aren't going away in the near future with what we're seeing going on right now. So thank you again. I really appreciate everything you're doing.
Yes, you're very welcome. Thank you, guys.
All right. Have a good night. Our next speaker is Mr. Richie Splitt, the CEO of Norman Regional Health System. As I'm sure you're hearing, a lot of the focus on making sure we can handle staying open is not just testing and contact tracing, but also hospital capacity, which is why you shut things down so they don't become overwhelmed, because people continue to have babies and heart attacks and broken bones and still need a hospital. So we need that amazing community resource to stay functioning. And so I thought we would invite Mr. Splitt to join us and just to give us the stats of where Norman Regional Health System is right now.
Thank you, Mayor. Can you hear me all right? Okay, good. Then I would like to share my screen if you can see that.
Not yet, Richie.
Okay.
Let me see here.
How about now?
Okay, there it comes. Yeah.
Okay, one more click. I'm sorry, I missed it. All right, well, I have with me tonight Brittany McGill. She's our Chief Nursing Officer, and we're going to do a tag team tonight. So I'll run through the slide deck, provide some data, and certainly entertain any questions. So thank you for having us tonight. Let's see. Here we go. I want to start with a blog that was written by Brandon Edwards. He's the CEO of Revive Health. Revive Health is a national think tank, works across the country and really keeps an eye on healthcare and on insurance companies and how those two work together. And in his blog, he talks about the era of no normal. And so I'll summarize this by working through the main points. The no normal began with challenges that will continue to require tough business decisions for all of us. That's clearly apparent. In the new normal today, hospitals will struggle financially. Insurance companies will reap the reward of billions of dollars in deferred and avoided care. Hospitals will continue searching for ways to refill the surgical suites, and the missing domino of patients avoiding their primary care physicians and those needed diagnostics and or other procedures has been a really significant impact on hospitals all across the country. And also, once thriving physician practices operate at a reduced capacity today, and they're looking for partners to stave off bankruptcy, and that is happening all across the country. In the no normal, healthcare is being redesigned, and it's being redesigned around the patients and their protection. In the no normal, telehealth is becoming normalized and providing new and convenient access points. What you're seeing here on the screen right is a recent case study that was published by Amwell, and it features Norman Regional Health System. And you can see there in the red underlining, in less than 72 hours, we actually implemented almost 200 providers in that virtual setting to care for our patients to avoid that missing domino effect. And we are today talking more openly about disparities in healthcare access, and those are the social determinants of health that you've heard me talk about before. It is also, as is on the ballot today, State Question 802 and its impact all across the state, expanding healthcare coverage and the like. The era of no normal means that Norman Regional Health System will adapt to current conditions. We have from the beginning and will continue doing that. We're prepared to stay in this uncomfortable mode for an unknown period of time and as long as it takes. And we will not be effective functioning today the way we did in early March. And we cannot assume that the current state is the new normal, because it is not. It is the no normal currently as we figure out our path forward. So the era of no normal, as interpreted by Brandon Edwards, suggests that we just have to deal with this for now and keep working in partnership with providers and our leaders across the communities to address this no normal state. So at this time, I want to turn it over to Brittany McGill, and she's going to walk through some of the data here on as it relates to Norman Regional Health System.
Hi, thank you so much for having me. So currently today we have 2 inpatient campuses. You know this, one on the east side of town, which is our Porter location, and one at HealthPlex. And between those 2 campuses, we have 5 hospitalized COVID patients. And so we started tracking this heavily when we set up our incident command, which occurred in the middle of March. And over that time period, we've been testing patients inside the hospital, outside the hospital, and through all of those various settings, our percentage of positives out of that 9,000 plus tests have been 4%. And so since we started tracking this mid-March, we have hospitalized or admitted 79 COVID positive patients. Now, out of those 79, they're not all ICU level care patients. We do cohort them because that's the best thing to do clinically, is to keep those patients together. Our highest inpatient COVID census actually occurred on March 24th, when we had 15 patients between the 2 facilities. In the past several weeks, our average COVID census, as it results to our overall patient census, we've got about 220 in-house between the 2 facilities. And out of all of those, there's been about a 2% COVID positive rate. We're running an average length of stay of about 7 days for those patients. And then I wanted to touch on ICU capability. So capability is one thing, COVID population is another. So we have 16 ICU beds at the HealthPlex campus, 20 ICU beds at the Porter campus, so 36 licensed ICU beds between the 2. We do have COVID patients in those locations, but like I said, we're also cohorting those patients together. So we do have COVID patients in our ICUs today that don't meet ICU level of care needs. Their level of care is much less than an ICU stay. We do have an ICU overflow plan that increases our ICU bed capacity should we need it, an additional 40 beds. And then what we are required to submit to the state is a surge plan, which is additional beds even beyond that capacity. So all in all, we are managing well. My participation with you all earlier on in this COVID season was around our surge plan and what we were going to do. And so we spent that precious time putting those plans together if and when a surge does hit.
So I just want to go back to this average census. This is all patient types. So about 220 all patient types. And of that, only 2.2% of them have been the COVID related or COVID positive patients. Okay.
So moving on to antibody testing, we started offering this service to our employees, which we refer to as healers. And then we moved on to offering it to the community. And so what you'll see here is out of all of our healers or employees, the percent of present is only 2%. And the percentage of having antibodies not present is quite high. We still do not know what that threshold or level is to develop immunity. So you may have antibodies present, but that doesn't necessarily mean that you're immune from getting it in the future. And so when we rolled this out to the community, you can see the number of community members that we had tested here. And then the percentage of antibodies present in the community has been around 4% for that population. And this is kind of a trend graph, if you will, over the months as to the average of new hospitalization cases. And so this just kind of reiterates that we saw the highest hospitalization count in the later part of March, early part of April. And then we've been averaging about 2 new cases per day since then.
Thank you, Brittany. So I wanted to now touch on red flags. So what do we look for? What's this surge that we would look for in that surge capacity alert? And there are a number of factors that we consider, and they should be familiar to you all. So it's access to COVID-19 testing supplies. Can we test? Today, we are actually testing every patient that gets admitted to our facilities, one of our facilities, and we are testing every elective surgical case as well. When we have testing supplies, as we do, an inadequate supply, we can know in advance of any procedure and how, again, to cohort patients if they are positive or not positive with COVID-19. So testing is a big part of our red flag watch. Hospitalizations and or capacity, both COVID and non-COVID patients, is one of our red flags, knowing what our, as Brittany went over, our current existing ICU capacity is versus having to expand in a surge capacity mode. We know what that count looks like. We know where those patients would need to be. We would watch that and do watch that very closely. ICU capacity is another one. Again, going from 36 to 76 is a surge plan for us, but we would want to watch that and do watch that every single day. And then access to personal protective equipment is a big priority for us. I know we hear that PPE is plentiful. That's not our experience. We have adequate supplies of PPE, but we have to work hard every single day in order to achieve those supplies. And I want to give you an example, share with you an example of what that means to us as a health system. Just last week, we were notified by a manufacturer of our current disposable gowns, and they were sharing with us a price increase going from 64 cents per gown to $3 each. So here's the math. It's a 369% increase in that cost. We use nearly 4,000 gowns per week. The average annualized cost for this price increase is $607,000, or nearly $500,000 in added cost to the health system because of this price increase. So we're dealing with those challenges on top of just access to PPE that is in ready. We have a ready supply today, but we work very, very hard to find those supplies and keep them coming in. And we are in very good shape in that regard. So in the end, in the era of no normal, Norman Regional Health System is leaning into this discomfort and uncertainty to meet the existing, the current, and the future needs of our patients. And we are ready, have been ready, and we're proud to be able to serve our community in the way that we do. Just a quick note on our testing. We too provide that testing that Brittany mentioned. Antibody testing is $31 if anyone wants to walk in and be tested. Our turnaround time for the COVID-19, the PCR test, is around 24 hours. We have excellent capacity today, and if someone wanted to be tested tomorrow, we would likely have those results returned to that patient by the very next day. So if you are hearing of needs, we can provide that service and have been doing that since the 3rd week in March with our mobile COVID-19 testing, drive-through testing facilities. So
speaking of, how would, let's say, a business who's had a surge of employees test positive, which I know is happening because many employees in certain areas of town are young people that are out and about. How would a business owner contact? I mean, would they just call and say, I would like 20 people tested type situation, or how would that work, Mr. Split?
it's easy.
Okay, I'll answer that one. So we do accept walk-ins that want to be tested, and we have the capability to do that at multiple locations. And so those hours of operation are 12 hours throughout the day at our multiple sites. And so people can walk in, pay their $31, and then like Richie said, they'll have their results rather quickly. So in your example of 20 a day, not a problem for us. And if there is a business that is interested in doing that, we would be happy to accommodate. We've actually done that before, and it's worked out well. If we need to come in, after hours, we can make that accommodation.
Thank you. I appreciate that. I know that a lot of employers are going to be thrilled that that resource is right here in Norman with such a quick turnaround time. And I had a quick comment about, we keep hearing about herd immunity. If you're seeing, 4% of people, I've seen herd immunity be between like 70 and 80%. So that's just not realistic. And I think until we get a vaccine, we can just take that phrase right out of our vocabulary as a part of our approach to handling COVID-19. Does anyone else have any questions for Mr. Splitter, Ms. McGill, Ms. Bierman, Councilman Bierman, excuse me.
Whatever you want to call me, fine. I've been called a lot worse in the last couple of weeks. So I had been in talks with Mr. Jason Smith, who's been sending us our daily updates about possibly getting kind of a daily update on ICU capacity. We know how many people have been hospitalized with COVID on a daily basis, but that doesn't really give us a sense of what your total ICU capacity is on any given day, considering, as Mayor Clark said, people don't stop having babies or, getting in otherwise traumatic situations or circumstances with their ongoing illnesses. So is there a way that we could get that information included on the daily gating criteria spreadsheet that we get? And then also, just on a related note, our up-to-date data on hospitalizations is only up to date as of June 24th. So if we could maybe get some more recent numbers than that.
So I think part of the challenge is, as Brittany mentioned, we cohort those patients in ICU. And so it's a low number of COVID patients inside our ICU. So I think the better number is the hospitalization. It is those positive patients, because we push a number of patient types into the ICU level. So we would manage those patients as we did from the beginning of this, the pandemic. We've managed those patients and their placement throughout. So if we were to tell you, I don't know what our ICU census is today, but it would be at a level that wouldn't make sense for planning purposes, because they're not all the COVID patients.
So it's a little more amorphous than that.
Much more.
You tend to keep them not necessarily every single COVID patient is in ICU.
Well, we tend to cohort them there, even though they may not require that level of care. So it's because it's easy we've trained our providers. All of our healers are trained. They know how to handle those patients, their PPE and et cetera. That makes it easier to cohort them. We don't have to do that. We do it because we have the capacity, and it's a safer approach. So they tend to be in the ICU, which would overstate the number of patients in an ICU is my point. Okay.
Then I appreciate that. And then also just on getting some more recent numbers than June 24th. I don't really care why, but it would be nice to know if these new daily increases that we're seeing are resulting in higher rates of hospitalization. And right now we're getting the daily numbers from basically just a day or two prior, but our hospitalization numbers are pretty far back. So
I think that EpiCurve data is generated weekly. Is that what you recall? So it's information is updated at the end of the week, and then it's submitted in that way. So, and again, in the data that Brittany shared, our swing goes from 0 to 4 to 5 positive COVID patients. It's not up to 15. It's just, and that's why they aggregated such small numbers over time. I think that's how that gets collected.
Okay, then yeah, I guess expecting it weekly and knowing it will come weekly is
Mm-hmm.
I guess just as good of an answer as yes, we'll get it up to date. As long as I know kind of when those numbers are going to be coming, it can kind of help me keep
It's
an eye on.
typically at the end of the week that gets aggregated. Sometimes it's available for us to share, to submit by Friday, but oftentimes it's first thing on Monday that the report gets generated.
Sounds great. Then looks like we should be getting a more recent update here in the next couple days, I would expect.
Yep.
So I
Yes.
appreciate that. Thank you.
Sure.
Thank you, Councilmember. Do we have any other questions for Norman Regional Health System?
Councilmember Patron has a question.
Hi, Mr. Split. Hi, Brittany.
Hello.
Thanks so much for joining us. I just had a quick 3 questions. We were discussing and numbers came at me kind of fast, so I might not have written everything down statistically. It may have flown over my head, but early on, I know we were seeing more hospitalizations, obviously with our aged friends in the city. And I'm wondering if now that we are seeing more statistically younger people testing positive, if we're seeing any difference in the ages of hospitalizations.
Sure. I'll take that.
Yep. I can take that one. So in mid-March, the age of our hospitalized patients was towards the older end. And what we're seeing now, hospitalization wise, it is a wider range. So we have some, 40-year-olds and we have some 80. So that range is wider than what we were seeing towards the end of March. We will confirm that what we've seen on that out of hospital testing, like on the outpatient side, it is more of that younger population. For sure.
Okay. And then just so folks, average survival rate if you were an actual ICU COVID patient as opposed to a hospitalized COVID patient, what does this look like so that the people in the community understand the risk? If you're terribly sick, what are your odds here?
Well, I don't know that we know enough about the virus to give you an odds kind of rate right now. We do know that patients that have comorbidities like pre-existing conditions have had a more challenging time than, let's say, someone that is younger and doesn't have those established yet.
Okay.
So, and it's also, we need to be careful in that ICU part of that question. So if someone thinks that I have a friend or a loved one in Norman Regional and they're in the ICU, remember, we're cohorting
Right.
all patient types in that area. So it becomes,
Require
maybe I can
critical
point.
care. That's what I was trying to get at.
Right.
If you require critical care. Early on in this, there was 1 in 5 requires critical care. Of that 20%, 20% of those, went on a ventilator or that kind of thing. And so I wondered, as this has progressed and we've had more time behind us to look at numbers, if those types of statistics have remained the same, or if, since we're seeing younger patients that are now being hospitalized, if the statistics have been a little bit more forgiving because we have some younger patients, or if it's, you just got it bad, you got it bad.
Yeah, well, and what happened specifically here in Norman was those outbreaks that occurred, and that's where we received a large number of our patients from. And so I think that those patients and those comorbidities are going to skew the number. And so
Certainly.
I just, I don't know that we have enough.
They're very high risk patients, certainly.
Yes.
And then my final question, I'm sorry, go ahead, Mr. Split.
No, this is Gary Raskob. I can comment on the mortality questions that you have asked, because I think it's important.
I would love to hear the answer to that, yeah.
So looking up the data today for Oklahoma overall, up-to-date current data, the case fatality, just anybody gets COVID, about 2.8% of those people die. In Norman, it was a bit higher right now, and that's, as was just pointed out, still reflecting the early high mortality of the nursing home impacts and those patients who came to hospital. Generally, and I think what Mr. Split has pointed out is really good. Most hospitals are doing that. Cohorting the patients is exactly the right thing to do. What I would predict from the data is that soon, though, your ICU will be mostly COVID. because of this progression now of the number of cases, there's going to be more and more people. It's just mathematics. It's just a proportion. A reasonable number, roughly, to use is 3 to 5% of people infected will end up in ICU. Although as more and more of the very younger people get infected, that might drop. Now, the real concerning statistic is if a patient is COVID positive, goes into ICU, and progresses to the point where they need a ventilator, that harbors a bad prognosis. And the data from New York and other hospitals and other places, lots of data. If a patient with COVID has to go on ventilator, the mortality is very high, 50% or more. Now, the physicians and critical care teams are learning very fast on the run with this, and it's quite impressive the progress they've made. And so they're learning better which patients to put on ventilator and which not, and they're making good choices about that. And sometimes it's better not to go on when they thought before they should. But what's also happening, of course, are some clinical trial data are coming forward on treatments. The most striking one recently is for those very sick people, if you have to go on a ventilator or just before you're becoming needing of a ventilator, a treatment with a simple available drug now in all hospitals called dexamethasone has been shown to reduce the mortality rate by about 20%. So it's been a very positive, encouraging result, very recent, from a big study out of UK. You probably heard on the news, remdesivir is the antiviral drug that's becoming available more and more and being provided. That has an important effect. They've not demonstrated a mortality reduction in the studies, but I think it's due to the numbers as they pool that data from larger studies. I think we'll probably hope for the observed results for remdesivir maybe to also be reducing mortality by 20 to 30%. Now, to private insurance, remdesivir is costing about $3,000. But you probably heard on the news that the company made an agreement with the federal government to provide it to Medicaid and Medicare and low-income people for $390 or something like that per vial. So there's a lot going on with those things. But positive news on some treatments. Of course, the other studies are going on with giving antibodies from COVID patients to existing patients who have COVID, and that has, I think, a reasonable likelihood of being quite effective. And then there's some other ones with the anti-inflammatory or the anti-rheumatic medications to prevent the crisis that happens called cytokine storm. So drugs that are commonly used now for psoriatic arthritis, rheumatoid arthritis, inflammatory bowel disease, these antibodies, they may well be quite effective. And there's one study suggesting one of those is. So the treatment side is moving fast. So I think the mortality will be reduced very significantly. But I think we should still have very healthy respect for this as a lethal condition potentially, particularly as was mentioned for those with underlying heart and lung conditions and diabetes. And the data, some large data out of Italy, what concerns me very significantly because of the prevalence of diabetes in Oklahoma. If you have diabetes where your blood sugar is not well controlled, the case fatality rate from COVID in those patients was 10%. If you have diabetes where your hemoglobin A1C was very well controlled, down at the 7 to 8 range, the mortality was 1%. So the underlying conditions do also drive things very significantly. And so given the health of Oklahoma's population, it's important that we try to reduce the number of cases in these vulnerable groups for sure. So, sorry.
Dr. Grasskopf, a follow up on that diabetes question. Does it make a difference if it's type 1 or type 2? I'm thinking about kids going back to school.
It's mostly type 2.
Okay. The final question I had for Mr. Split, I think was, I'm hearing a lot, we've talked about vent machines a little bit, but I'm hearing a lot on the news about dialysis machines, and apparently COVID is attacking kidneys, and there's been a shortage of dialysis machines, and that COVID patients aren't doing so well even with the dialysis machines. And so I kind of wondered what our situation was in Norman for vent machines and dialysis machines.
Sure. So with ventilators, we have plenty, we own plenty, and we have rented and had rented those back in March. And so we've got an additional supply. We've also purchased all of the extension devices that go along with the ventilators. And like you've heard, that's not resulting in being, the best option. So we feel good as far as ventilators go. We haven't experienced the dialysis situation that a lot of other facilities have. And so we are preparing should that occur, but we haven't encountered that yet. And we are part of a contracted service that services lots of other hospitals in the metro. And so should we get into a pickle, we can work with our partner health systems and help each other out.
Thank you.
And I think Brittany makes a great point. The way we all work together through this, across the state, how we're working together for the appropriate level of care, the appropriate treatment it's been remarkable. It's truly been a unifying event, and it's been great to watch and to be a part of. We certainly have been at the table and providing our information, asking questions about ways that we can work and treat patients better. And it's been very, very effective. So I want you all to know how important that's been, that we've been very collaborative. All hospitals have been very collaborative through this process, and it's been very effective.
Thank you. We did have a question. Oh, you answered it in the comment. All right, never mind. Any other questions? Well, I will go ahead and say it publicly so everyone watching might have had the same question. The antibody testing is $31. Insurance is typically billed for the PCR COVID-19 testing, and that's if you have a doctor referral, correct? That's when insurance gets involved?
Correct.
Okay.
If you have insurance,
Yeah.
Right.
Okay, and then the cash pay price is the $65 for the PCR. The antibody is $31.
Correct.
Okay. Any other questions from council for Norman Regional Health System?
I don't see any, Bria. I'm sorry.
Okay.
I was just staring at you.
It's all right. All right, Mr. Split, Ms. McGill, thank you so much. I really appreciate you being available and answering these questions. I'm grateful to have community partners like you who are willing to be transparent and communicative, because as I've said before, in a pandemic, the worst thing that we can be is not transparent with the information and status of important things like our health system. So you are appreciated.
Thank you.
Our next speaker, we have Dr. Grasskopf, who we've he's from a bit already. He's been a part of the emergency management team as well, epidemiology with OU Med. So I will turn it over to you, and I'd love to hear kind of the trends that you're seeing and best practices going forward.
Okay, so thank you, Mayor. I'll just show one thing first to just get, where's my, share the screen. Let me just show a couple slides at the state level, so just because they're illustrative, and I think you can expect that what we're going to see in Norman is going to mirror that sooner or later. So first of all, here's the update from today. And everybody, is that sharing well?
Mm-hmm.
Yes.
So new cases, Oklahoma County 181, Tulsa 120. There you see Cleveland down there. This is based on the state data Jackie give you a report, and Assistant Chief Jason Smith's been documenting all the cases. One of the concerns, of course, and this is the issue was mentioned, is that sometimes the lag time between these tests. So sometimes we get dumps of new cases in a particular day, and that is why we sort of like to use a rolling average. But you can see that for the state, there's a clear trend of increasing cases over the last 2 weeks. And it's gone up on a 7-day rolling average here from, 17 June 203 up to now about, over 350 to almost 400, 390 new cases statewide every day. And different counties are going to see the impacts of that in different time trends, but I think they're the major ones, the big population ones, Oklahoma, Tulsa, Cleveland County are going to see it significantly. This is the next important observation to know, is that, just to be clear, we are testing more, but the spike in new cases is not due to more testing. This is a statewide data again. Here we are back in April 19th, 4.9% of tests we did were B positive. They were running about 17,000 tests a day across the state. Here we got up to the peak of about 36,000. So as we increased testing here very clearly over a month between April 19 and May 17, and we were testing more asymptomatic people and so on, the positivity rate did drop and it went way down here. And you see by about 25 May, it was a low point of about 1. But now what we've seen over the last month or 5 weeks is that the percent positive rate of tests has climbed steadily up here, despite the fact that we're doing about the same amount of testing here, between 30 to 36,000 tests during that period of time each week. Okay, so this means that more infections are occurring in the community and more people are being infected. It's not an artifact of testing. There's spread happening of the virus, and we're picking that up with the testing. Then the last slide, which was relevant to the discussion, here's the hospitalization data statewide. So back in April 7, 8 was the peak in Oklahoma State, wide for the number of patients hospitalized with COVID. Here for the date, it was these numbers, about 190 approximately. You can see that the efforts, sheltering, different things, we saw a decline in those cases, hospitalizations, right down to a low around May, middle of May, of 60, 70, 80 hospitalizations. And now we've seen a steady increase in hospitalizations, as you see out here, to end of June. And so we're now at more patients hospitalized in the state with COVID than we were at the previous peak of the epidemic in the early April. Okay. Of course, this is going to vary. You've heard the report at Norman. I think, if things are just let to progress with no action, that's the point I want to make, then you would anticipate that this same pattern will happen in Norman and the hospitalizations will increase there. So I'm going to stop sharing that. And then I just want to show one other, if Jason doesn't mind me showing one of his great graphs, because he's just been doing such a great job. And I think, again, this illustrates very clearly something that I think everyone here on council should know. And this is the confirmed positive cases, 3-day rolling average for Norman and city of Norman. Okay, so here you see on the peak, say at 9, 10 of April, you were up here, and the efforts that were taken were very successful in the city of Norman, drove it down to between 0 and 2 cases a day from May 3rd all the way here to, 21 of May. But then as reopening, and then even there was a little bit here, but again, that continued. But as reopening progressed and then other activities began, here you can see very clearly what's happened with the daily new cases. And I think this picture is very clear. This is June 14, last 2 weeks. Here you are. So you're up now at, I think I have to scroll over to see what that number is, but I think it's in the 20 range, plus or minus. Yeah. Well, no, 17, 18, but it varies, but it's, it's gone up 8, 9 fold, right? And again, if this is just left to continue, it's going to continue to increase. Now, we know that most of these new cases that are being detected are from analysis of the state data, are in the population of 18 to 35-year-old individuals. We have some more granular data from Oklahoma City County, which shows that what we basically want to do is use the contact tracing information to understand where these new cases are getting exposure. And so there, as you would imagine, people attending events that are large group gatherings without masks and social distancing. But the things in Mayor Holt's press conference were 7 factors where they were able to find some, and we're analyzing that data in more detail over the next few days. But, and the interesting thing is, it's not just a matter of pushing a button on a state database. Actually, the contact tracing information is written out in the comment section, so people actually have to read these forms and tabulate things. That's why it takes a bit of time. But bars, pool parties, weddings, funerals, other graduation gatherings, large group gatherings where people are sitting close and not wearing masks will foster this progression and growth of cases very clearly. So I'll stop here. I'll say, Mayor asked me to say 2 other things. What can you do about it? We'll leave that for the moment. What is OU doing? Right now, as you know, President Harris appointed Dr. Dale Brassler to be the COVID officer for the university. So we have a very coordinated, centralized effort for all universities' activities. Those were some of Dale's slides I was showing you. He does a daily report on what's happening with COVID. There is plans to come back to in-person classes on the Norman campus in the fall, provisional plans. But there is, as you know, was announced, I think, with the president and the media, the university is having a universal required mask policy. So if you're on the campus, other than walking outside where you're distanced from people, any other time you're on the campus or sitting or present in rooms or buildings or other things, you'll be required to wear a mask. So that's the single most important intervention. That's the first thing. Class sizes will be limited. So there's been a lot of work about scheduling. So you're having to shrink. Any class over about 140 will have to be by virtual. Classes below that are being split up so that no classes are going to really be more than 40 individuals. The rooms are being managed so that people are spread out at least 6 feet apart in class. The schedule has been revamped so that not all the classes are changing on the same schedule. So there's a staggered schedule, because if you ever go on the Norman campus and watch what happens between classes, it's a huge crowd of people moving around. So that's being mitigated also in the halls of the buildings. And there are other steps taken to distance people in common eating areas, various other things. There's many, many layers of this, but the two major interventions, number one, far and above, the most important is wearing a mask. And secondly, then distancing, not being close right up on top of each other. And, you know, I won't speak to football tonight. That's being worked on. I think they're taking it very, very seriously. But the university has an intensive effort going on many levels with regard to social distancing and doing everything we can to mitigate this. But I'm still worried about areas where it will be hard to control people coming into close proximity to each other. So I'll just come back. The most important thing is for us to create a culture. I think what the council can think about are, I think my recommendation would be, we work with Jackie at Cleveland County to dig deeper into the contact tracing data in Norman, but I think she's got enough already ideas about where things are happening. You might have to take some steps on intermittent or temporary suspension of activities at large public areas where people are getting together closely without masks, like pools and other things like that. You might want to be thinking about bars. We have to work constantly to create the culture of people accepting wearing a mask, I think, is the most important thing. And to get people buying into that. And various campaigns are going on that, and I think that's really good. Happy to, I'll stop there, Mayor. Happy to go into any other detail or questions that people have. But I really like what Richie presented in terms of the context, which is, it's not a normal, there is no, okay, this is the state now. It's going to be constantly changing. And we have to have a mindset where we're accepting that uncertainty and flexible to take steps that may be needed to deal with temporary spikes or outbreaks or other things. So I would encourage the council to begin thinking about, you may take intermittent actions. You may say, okay, we're going to suspend this kind of activity for a period of time or whatever, and then we're going to relook and come back. You know, not and more strategic surgical type of actions directed to areas where the data shows are driving the transmission. So that's the concept.
Dr. Raskop, I think my concern is we have such community spread. It's really hard to be as strategic as I had hoped.
Yeah.
So, and I'll throw out there, you know, to be clear, the University of Oklahoma is a political subdivision of the state within Norman city limits. So I don't get to cancel football. But the idea of a spring football season, summer Olympics, and a fall football season, man, doesn't 2021 look way better than 2020? But again, that's just something I daydream about. But Councilmember Scott has a question. Let's turn it over to her.
You're still muted.
Sorry, thank you. Just got a question to ask if patients in the ICU area are charged for ICU prices if they do not require ICU level of care.
So I assume that question was directed to us, and the answer to that is no. It's just about the cohorting and the expertise that we can bring together and care for those patients in a similar setting.
Okay, thank you. Yeah, I know it was about minutes ago, but I wanted to make sure we got that out there. So I appreciate you coming back. Thanks.
All right, Brenda says we have questions all the way around. So Madam Clerk, I'll turn it over to you to call on people.
Councilmember Bierman.
Ooh, got to go first again. So I really, before, I know everyone else has a whole bunch of questions, but I was kind of trying to consolidate all of this information into just a few bullet points. So stop me if I'm incorrect. That we have testing supply capacity, more than adequate, but we have a shortage of trained testers who administer those tests. And of course, we know that we need high quality testers to ensure testing accuracy. We have a higher percentage of positive tests, not due to increased testing, but just more cases in the community to find. We have a lack of consistent and affordable healthcare that leads to higher mortality rates among those with pre-existing conditions who are not able to manage it, like diabetes, which also lends itself to the assumption that lower income residents are going to feel the greater impact of this. If you are not able to manage your diabetes, it is often because of a lack of financial ability to do so, which also leads into, we have cost hurdles for testing. If you're not able to get into the health department, $60+ to get a test can be difficult for people. We have high rates of infection among young people who more often than not work high exposure service jobs. Our significant case increase is not due to super spreader events, but passive community spread, and that masks are critical components of mitigation strategies. Does all of that sound accurate, or does anyone feel that I have misstated something from one of our experts?
I think one caveat from Norman Regional is that we have more than adequate testing capabilities and those who can provide that testing. So just that caveat from within our health system, we're geared up and ready to go.
Well, then I should say we have a shortage of trained testers at the county. Make sure that that's not too broad. Okay. No,
I would add one quick thing about the county, Councilor Bierman. If I heard correctly, it was because of the heat right now, not just that they don't have the actual numbers. It's just a tremendous burden because of what they have to wear and to be outside. So, but clearly translates into, well, then we need more, as we're not going to cool off anytime soon.
Well, I appreciate all of that. I just wanted to make sure that I kind of had those bullet points correct. When we get through kind of all of our presenters and the questions with them, I kind of have some things that I would like us as a council to think about when we're considering next steps. So thank you.
Definitely. Thank you.
Councilmember Patron.
Mine's quick. I just missed Dr. Grascob. You spoke about OU, and there is a I've had some different parents reach out to me of wanting to know about Greek houses and fraternities and sororities. And so there's this passing of the responsibility back and forth as to whether or not that jurisdiction is for the city or whether or not the jurisdiction is OU. And I know that the people that have reached out to me are saying they're trying to put more people in it this year than they even were in years past, and it's impossible to socially distance. What can you provide us some counsel on that as to how the city should be, if we should be considering getting involved in that at all from a licensure standpoint, because they are boarding houses under the city of Norman, but by the same time they are Panhellenic and IFC governed at OU. So is OU doing anything about this?
So I think that's all I can say. I can't give you definitive information today because that's one on a list of, several areas of concern, of course. And I can tell you that with Dr. Bratzler's leadership and with an excellent group of people, they are looking very, very carefully at that. And I think more information will be forthcoming in a little while, but
it's on your radar, and that's what I cared to
very much on the radar. The dorms, the houses, those things are absolutely very much on the radar. In fact, I think those are probably one of the items that are giving the greatest concern because of the close proximity of living. So yes.
I appreciate your time. I'll pass my time.
But more will be coming soon. So ask for your short patience and more data will be coming.
Thank you.
Or more announcements.
Councilmember Hall.
Okay, this is for Dr. Raskob. Thank you so much for guiding us through this once again. I was interested in elaborating a little bit more on the contact tracing piece and how that could help localize where the spreading is occurring, because you mentioned the Sirius 7, I think, has been referred to, of where we're thinking this is coming from. So do we have robust enough contact tracing to be able to drill down into that a little bit more so that we can maybe get more strategic over time in targeting where the hotspots are, or are we past that point?
No, I think, you know, you heard from Jackie earlier, I think the Cleveland County people are doing, you know, a great job at contact tracing and all of that. I think there may come a time where the amount of tracing might outstrip the available people. And she told you they're struggling with the issue of heat and all of that, and they're full up, you know, and appointments for testing and all of that kind of thing. And so the crucial thing with contact tracing is that it happens promptly after you find a case, because what we know from the COVID is that the time from when someone gets infected with COVID until they infect someone else is about 4 days on average, during which time many people have no symptoms. So they're pre-symptomatic, or they may never develop symptoms. So if we have a person who had an exposure or symptoms needs a test, and they have to wait for that test, and then we have to wait for the result and then do the tracing, we're sort of defeating the purpose. So a lot of people are working really hard to bring to bear a fast process and to be able to get a test back quick and then trace and get to people, you know, by phone and say, please take some steps because you might have been exposed, and so on. So that's really important. And I think that there will need to be some surge capacity for that. And I think that's being looked at very carefully, both at the health department and also internally, because we know we're bringing a big population back potentially in August, September. And so that's on the screen of things that we'll do.
Okay, then my next question is what we're seeing currently is the increased number of cases in a population, a much younger population. But I'm assuming those same comorbidity characteristics would apply to this younger population as well. So I think could you address just I think there's an assumption that if you're in this younger age group that you're not going to get that sick. Is that accurate?
It's generally, it's all probabilities. It's not absolute, right? So it's risk, and that's often difficult to communicate to the public. But your chance of getting seriously sick, if you are seriously, i.e. needing hospital and or ICU, if you're a 30-year-old or 25-year-old without any other major health problems, is much, much, much lower than a 65-year-old person with underlying heart and lung condition or something, okay? The real concern about the young people is getting through the message to them, and I think that's something we should work on very significantly, is yes, they may have a much lower chance of getting seriously ill from the infection, but they may go home to grandpa and grandma or their parents or others in a family circle and pass it on to them. And so I think we're also now, we haven't yet seen the impact of this uptick in cases. Look out 2 to 4 weeks and see who all of these young people have interacted with. For example, family parties on July 4, or large get-togethers of people for birthdays or other things. And we will then begin to see the community spread unintentionally from young people to other older people who are vulnerable to becoming sick. That's the issue.
Okay, then the next thing I wanted to ask you about is I couldn't agree more that we need to create a culture of compassion, as I see it, that you are wearing a mask to help someone else be safe, and that person is choosing to wear a mask to also protect you. They're not protecting themselves by wearing a mask, as I understand it.
Well, so generally you understand it correctly. The main emphasis, of course, is to say, I'm wearing a mask for you and I want you to wear a mask for me. And there's a campaign that uses that language. That's very nice. In fact, the evidence suggests that the mask wearer, at least for basic surgical masks, and we're not recommending N95 masks for people out in the community, that's for healthcare settings. Basic surgical mask probably does protect the wearer also, based on recent systematic review of the literature, and beginning to weave that into the messaging, because if that convinces someone, well, gee, I actually get a benefit as well as protecting, then we might get a better compliance with wearing the mask. But you're absolutely right. The culture is about us taking care of each other, and I take care of you and you take care of me when we wear masks.
Well, and that's really good to know that the more recent studies suggest that you have an additional layer of protection for yourself as well.
Yeah, and so one problem we're facing in this is, you know, at the very beginning of this campaign, we heard from federal officials, even the Surgeon General, don't wear a mask, don't, you know, because what they were doing was they had a big shortage of PPE equipment, and they were trying to prevent the public from a rush on buying those things. And unfortunately, that has led to tremendous confusion that we're having to go backtrack in the messaging and fix in getting back to people. So we still have work to do, and prominent work to do on getting the message out that, but absolutely, wearing a mask protects everybody. And if we all do our part, we protect each other. But hey, if you actually are wearing, you probably get some benefit from it as well.
So this is my final question, because this has been asked multiple times as we've been having these conversations. Is there any age group, or is there any particular cohort where it would be recommended that they don't wear a mask for some reason?
No.
Thank you.
And I said it a bit definitively, I mean, I think it's unlikely, but look, I saw a great tweet from one of my colleagues who's an interventional cardiologist in Brigham Hospital in Harvard. And he said, I basically wore a mask at work for 30 years and I don't get low oxygen. I don't fall asleep because of my carbon dioxide. I don't get other, you know, there's no, you know, now there may be occasional very selective things with certain people, but I think generally for the general public, there's not a reason not to wear it.
Okay, thank you very much. Those are all the questions I have for right now.
Okay, Councilmember Wilson.
My question was about the masks, and you answered that pretty fully, but I also thought about another one you might be able to answer, and maybe not. Is there any indication that, and I know it's probably very early in having a novel virus, but is there any indication that this sticks around in the body and does damage that we'll see later on in life? Or that's my concern with the young people. So am I off base there? I'm not in any way educated in that area.
You're very much on base. And of course, we don't have long-term follow-up yet. Like, we don't have 5 and 10-year follow-up of this, of course, but there are beginning to emerge some reports of long-term impact. and long-term. So for people who get sick in ICU and manage to survive and so on, we know from other things. So they have a complication called ARDS. We know from other studies, those people will take at least about a year to recover their lung function. And there are some other emerging reports about certain other symptoms persisting for months in some COVID patients, but those studies are going to be ongoing. But it is a concern.
Thank you. That's all I had.
I know Councilmember Carter.
Hi there. Thank you so much for this very informative presentation. I got a statement and then a quick question. I think it's a no-brainer that we need to have a mandatory mask in public in Norman. I think this precipitous increase in caseload is frightening. And to wait until Mr. Split's letting us know that ICU and COVID hospital beds are starting to fill is too late in the scheme of things. So my question is that it has to do with compliance. And let's just say if there's 50% compliance, which is what some survey data showed, voluntary mask wearing in Norman, and there's 25% that are just no, they're not going to wear a mask. But if we were to have a, say a 2-week window where we required masks in public and we were able to move the compliance from 50 to 75%, would that have a chance to flatten the curve and give us time to assess if there's more stringent or aggressive measures?
Oh, in a word, yes. I'll give you some mathematics on this. And so in general, in the community, the mask will reduce the transmission compared to no mask, so by about 70%. So let's say right now let's say you're seeing 20 cases a day in a population where nobody's wearing masks. You'll be able to reduce that probably very significantly down by 70% if everybody wears a mask, right? If half of the people wear a mask, then you'll reduce it by about 35%, half of 70. So if you then went from 50 back up to 75, you'd gain back half of the other amount. So I think the point is that the impact is significantly large, that even getting 50, 70, 80% compliance is worth pushing for in terms of its impact on the community cases, and importantly, what you began with, on the potential impact on the healthcare system.
Okay, Mayor, you have Councilmember Holman.
Okay, thank you. So kind of answer my first question, which was about basically if there is a mask requirement, if there should be any exemptions to any groups of people and why or why not. And I think you answered that one pretty well, unless you had anything further to add to that.
No, and I just want to note that Dr. Cook emphasized being a pediatrician. I was talking about adults.
Okay.
So.
And one of the questions I got from a doctor was actually about what the opinion might be about the used masks and in regard to them being a biohazard or not, and what would be the recommended action to deal with that. Because I know we are seeing them on the ground and places like that, kind of littered about, things like that. So that's one question I'd ask that I had been asked is, has there been a lot of discussion about the disposal of all these masks that everybody's wearing, and what is the, I guess, general opinion about that?
Yeah, no, it's a great point. I've not been involved in the discussions, but the people who do disposal of waste and so on would obviously, they wouldn't be picking those up with hands or touching them or those kind of things. I mean, that goes with the other recommendation about washing your hands and so on. But I mean, they would be using some kind of tools or whatever to pick those up and make sure they have gloves on and put them in proper disposal and so on. So it's a good point. We hope we don't just see them discarded in the street, but there probably should be some thought about that with waste disposal groups and so on. And then, otherwise people, you put them in your garbage at home or whatever, and the virus won't survive on that for long. I mean, long being 24, 48, 72 hours. So, but but we don't want to see them laying out on the street or where kids could touch them or other things like that. I think that's important.
So they should be handled with care, just to be clear. Clean up. Another question was about just concerns about the effectiveness of a mandate. We see so many people improperly using them, and self-contamination, not covering the nose, all sorts of stuff that I think we've all observed in the way that people are wearing them. So I had a question just about how to go about advising the general public on how to properly wear these. And if that's been a major discussion too, not just getting people to wear them, but they need to be worn a specific way in order to be effective.
Yeah, no, they do. And it doesn't work if it's not over your nose and mouth. I mean, that's the point. And also I see, there's a lot of education to do. It's a great point. Sometimes I see people in meetings, and when they're going to talk, they take the mask down. The most important time to have the mask is when you are talking. And the operating room doesn't take their mask down when they want to talk to each other during the operation. So there's a lot of education. I think it's a great point. We really need to step up the general, whatever mechanism it's going to be, whether it's virtual, video, whether it's going to be town halls, whether it's going to be other things, really step up the education, I think, about just proper way to put it on, different things, wearing it, the location, all of those things. I think if we make some videos or other things like that, I think that would go a long way. Of course, you have different segments of population and income that you have to reach on this, but I think working with the health department too, and with OU, we should really think about some educational efforts in a more expanded way.
Okay, I appreciate that. And my last question really is that basically folks are asking what's some reliable resources that you would recommend or others in your field are recommending that they could go to understand the mandate, masks, why masks are effective, things like that more clearly. I mean, some folks don't, for whatever reasons, may not trust the CDC or the WHO or the, all those things. What other resources should we direct people to? They might be able to understand better for why they should follow these guidelines.
Well, so I think that the CDC page on masks and so on will be quite good and up to date, and I think that we should, really restore trust in that. That's the agency we really want to be doing that. The state health department as well. The data and comments on masks and things there I think are quite good. I think probably, I don't know if our colleagues, Norman Regional, if they have a page where people can go on this. I think we'll be building more resources on this at OU, and I think we'll, you know, look to doing some town halls and other things. Those would be the places to look, I think.
Okay. Well, thank you so much. I really appreciate you taking the time to answer our questions, everybody in the meeting tonight. So thank you.
Thanks.
Next, we have Councilmember Scanlon.
I want to preface my comments with my belief that wearing a mask matters, and I try to do that whenever I'm around people at the grocery store, at City Hall, whatever. I think it's very important. That said, I've been barraged, as I probably guess that many of you have, with the "you can't do this to me. I'm not going to shop in Norman if you try to make me do this, blah, blah, blah." So I have two questions, and it's along those lines. And they're practical questions, I think. One is to the person that says, "You can't do this to me. It's my constitutional right, blah, blah, blah." What's the answer, Catherine? And the second question is, assuming we do put in place a mandatory mask policy, how do we enforce it?
Yeah.
To answer your first question, I see no evidence that requiring masks would be unconstitutional in any way. We have a right as a city to do things for the public health, safety, and welfare. That's our core function. Here we have CDC recommendations, WHO recommendations, recommendations from epidemiologists, from hospital staff, from a number of people saying that masks go a long way in preventing the spread of COVID-19. So I think requiring masks would be constitutional. It would be tied very closely to that public health, safety, and welfare function.
And I accept that, but certainly any declaration has to be, and I'm stating the obvious, I suppose, but it has to be accompanied by that emphasis to that very point.
So Councilman, just to, on this point, before you go on, and Catherine, you probably know there's a just very recent case law in Oklahoma on this. You know, you probably know about Guthrie and the experience there with Mayor Gentling, who tried to do this, and 5 citizens came together and filed a federal lawsuit on the constitutional, and the attorney in Oklahoma City's name was Urbani, and that was summarily thrown out by a federal judge. So
it was dismissed after they rescinded their mask requirement. So
yeah, okay, so it didn't get tested. Really.
Yeah, so
I'm trying to ask,
but I know a lot of cases about many COVID-19 restrictions are working their way through courts around the country. We've had some on other various aspects of restrictions, and so I imagine there will be some on masks forthcoming.
Yeah, and again, I'm all for wearing masks, but I'm asking what I think are practical questions. And the second is, with a mandatory mask declaration, how do we enforce it?
Well, we've talked about this internally, certainly, what would we do? And I think what we did from the beginning with the proclamations is probably the same approach we would work for here if you all were to elect to implement some kind of mask requirement. It would be education first, citation sort of the last resort. You really want compliance is all you're wanting. So I think the issues there are going to be availability of masks, signs at the doors of businesses that are allowing members of the public in to state that requirement, and doing things along those lines to really drive home the point that masks need to be worn.
And enforce declaration without some kind of enforcement causes us to lose credibility, and I'm worried about that too, particularly as we've gone along through these past months. It's been a sine wave in terms of are people listening? Do they pay attention? And why should they? So I'm all for the masks. I want to do what's absolutely right and what'll drive down these infection rates. But these are practical questions. Thank you.
Yep.
Councilmember Wilson.
Okay, the thing that comes to mind on Councilmember Scanlon's topic there with enforcement and the mandatory, I mean, not to be glib, but we require pants in public. Nobody says that's against their constitutional right to run around without pants on.
Seatbelts.
Seatbelts. There's lots of things that we implement for safety. Pants are just for comfort of everybody, I think. But I would say we would enforce it the same way we do pants. If you're walking around without your pants on, somebody calls it in and the police come out and tell you to put some pants on. So I think that's what's going to happen with masks. And I think that it's something we need to, it sounds like from what, you know, people, not Bob on the ward page, feels like, you know, people that I'm going to assume Dr. Raskob has a very extensive education in this, and that masks are going to be beneficial in the long run in our community. And so I fully support the mandatory mask if we go that direction. And pants, to be clear.
Councilmember Wilson, if I could, you know, kind of piggyback on that, we are a college town. As I touched on earlier, we're about to have, you know, 20,000-ish young people return, and over half of them come from Texas. And I know that many college towns are struggling with this. We've seen mask policies in Lawrence, Kansas, Fayetteville, Arkansas, Austin, Texas. So it's not like we're really being that bold and innovative here. I think we're just acknowledging rising numbers in the nature of our community. Any other questions or comments from council before we turn to our Councilman Bierman?
Yes, so a couple of thoughts. One is that I've been in touch with a number of people who live all over the country, and one thing that Fort Worth is doing is putting the burden of compliance on businesses. I mean, you can like that or not, but as a business, you are responsible for what happens in the store. And so if you have individuals in your store who are not wearing a mask, that business can then be fined or, you know, have a loss of their certificate of occupancy, any number of mechanisms by which that can be implemented. So throwing that out there, I will send around the Fort Worth information after the meeting. But I do also want to point out that throughout this entire pandemic, back when we first put in our restrictions before many other cities in our metro area, I was contacted by a number of people, particularly those who live in Moore, who said that they intentionally came and shopped in Norman because we were doing more to protect our residents than their community. And I've gotten 3 messages already tonight from people who have said that exact same thing. If you mandate masks, I will drive to Norman and shop because I do not feel safe shopping in my own community. And we have a number of towns in our metro area for which the extra 5 or 10 minute drive into Norman is not that much more in order to be safer while you do these kinds of activities. So I think it's important, while we might have some people screaming about, you know, going elsewhere to shop, we also have people who are sitting and quietly watching and hoping that we do implement new restrictions because they no longer feel safe in the community that they currently live and shop in. So I think that's an important component. Bringing it back to young people, I'm sure all of you and many of the people who are watching have seen the photos and videos of Campus Corner over the last few weekends. If we have not already had super spreader events, I think that is probably about as close as we would get to them. Packed bars, lines around the corner. So I do think that there is something to consider in terms of restrictions on bars or reduced capacity, because it is frightening to drive past Campus Corner on a Friday or Saturday night at about 10 or 11 p.m. and see what is happening there. So, but I also want to point out, City Manager Pyle, this is something that I hope you will be listening to as well. The first thing that we need to do is require this of city employees, all of our city employees. Not a day goes by when I don't get multiple comments about police officers not wearing masks. A lot of compliments for the fire department about the masks that they are wearing. So we have a lot of inconsistency even among our own staff And that is something that we absolutely need to address. I don't think we have any credibility on this issue until not just us, but all of our staff walk the walk. And right now that's not happening. And so, you know, Mr. City Manager, I don't know what kind of additional direction you need from us in order to make that happen, but that really needs to happen, because it's very difficult for me to defend mask wearing when someone has just had a recent interaction with a police officer and they are not wearing masks. So, you know, I know that there are officers who do wear masks, and I'm sure that there's a firefighter here or there who isn't wearing one, but it seems that the most visible daily interactions with city staffers are with police officers, and they are certainly not doing that or complying with the recommendations. So if we need to make that a mandate in some way, shape, or form, a resolution, or even just glaring at you strongly enough, Daryl, you know, then I think that that's something we need to have happen. So I support masks. I also support businesses and want to keep them open. And if this is the way to do that, because it doesn't look like we're going to be getting much more in terms of state or federal assistance at this point, I'm not really comfortable with anything much stronger than maybe some what am I trying to say? Occupancy restrictions on bars and going with masks. I think it is truly the very least that we can do. And there is plenty of information out there if you are interested in finding it, to show that there is a pretty wide consistency and support for mask usage among the scientific community, public health community, and frankly in the policymaking community. So that's where I stand with it.
Yeah,
Kind of building on a point, I just again to comment on that comment. My concern with going after bars is we have very few true bars in Norman, and many of our bars have restaurant licenses, and that's what they point to when they're opening up like restaurants. So I would be very interested in being surgical, as Dr. Raskoff says, in our approach to how we handle the large crowds gathering at these bars hiding under their restaurant license. So if staff could kind of talk about how we would do that, I think that would be helpful as well.
You have Councilmember Patron with her hand up.
Could staff probably talk about my question real quick?
Oh. I thought you were just telling us to be creative and think of some ways. We certainly, you're correct, we do not have that many licensed bars, especially on Campus Corner. There's really only one licensed bar, and that is the deli. The others are currently licensed as restaurants. You know, typically when we have a complaint about one that for whatever reason that's not officially operating as a restaurant, then, you know, I have the ability to do an audit on them. Haven't done that in quite some time, but that's one avenue we could do. And if that audit comes back that they are not meeting their food requirements, then they have a bigger problem about either going for special use zoning to be a bar or having to change their business model to meet the food sales. So coming up with more, I mean, that's just the straight.
Okay. So it's complicated is what I'm hearing.
It's very complicated.
Is it possible to, can we legally say at this time, no power hours?
I think we would be better off maybe just limiting the number of people allowed in the bar area. You know, if they're seating and it's arranged in a way that's accommodates social distancing, like many of the restaurants are doing, that's probably fine. It's really that bar area where people are just standing around and it gets crowded and it spills out into the street, the line to get in, all that kind of thing. So I think if you limit that area of a restaurant or a bar, sort of the bar function, limit the occupancy there, that may address the issue.
Mayor, I think to the point that was made earlier, there are other examples of businesses where you're going to, Sam's on Sunday can get pretty crowded. You know, different shopping venues, different other things. So I think if there's a way to get the business community to step up and come to the point about having masks in businesses, and the point that was just made about shopping and so on, you know, those are the same arguments when we went to anti-smoking ordinances. They said, you know, I'm not going to come there. And then they found that business increased actually in places that went to, you know, no public smoking in public places and so on. But I think, given what you just mentioned about these not really being bars, and not seeming like they're picked on or singled out and creating a group that is vocal or whatever, I think broad engagement of businesses to say, look, please just wear a mask when you interact with us, because, you know, right now voluntarily I see, whether it's the grocery store, whether it's the whatever shopping place you go to, there's still enough people not wearing it to create, you know, issues.
Thank you. Councilman
One other thing I was going to add, Mayor, is that because of the nature of their business, and when they are typically have their highest demand is later in the evening, one way, in addition to maybe reducing some of the occupancy levels at the bar area, would be a shorter closing time for them.
Thank you for mentioning that.
Earlier closing time.
Someone said Oklahoma City was closing earlier. Can anyone confirm that?
Oklahoma City, several of the restaurants in Bricktown were closing at 9 p.m. during the week.
Can you hear him? Okay. Go ahead, Foss. I'm sorry.
So no, found that out yesterday. Met some friends and didn't get to stay as long as we thought. So that is happening. That's a practice currently taking place.
Okay. Madam Mayor, Texas has implemented some curfews as well for early closing times on restaurants and all of that. But my question, Dr. Ruskov, I want to preface it by a memory that I had when I was a child. We had eaten at a restaurant in Oklahoma City. I think it was Mama something, I don't know. Anyway, a commercial came, a public health notice came on the news, the 10 o'clock news, that a cook had tested positive for hepatitis. If you have gone to this restaurant in the last week or whatever, you need to come in and have a hepatitis test. And since I was probably 7 or 8 years old, I remember it, you know, it was terrifying. Anyway, I'm wondering, why are we not seeing public notices for places in contact tracing? And this is going to be kind of a two-part question, because I think there's another way to maybe handle this, but why are we not seeing public notices where employees have tested positive, or places that the contact tracers have said that people have been?
Well, so I think the health department, the contact tracers are contacting the people. We're trying to narrow it more. It's a different infection, what you were talking about, because it was potentially foodborne transmitted, the hepatitis, right? And that, you know, many people who just had anything to eat there could be infected. But if you're not put in a position of exposure, close contact with a case, then you're not really at risk. And that's why I think they're doing it that way. Also, I think the laws are a little more strict about patient confidentiality now than maybe when you were thinking of HIPAA and some other laws. But I do know that I was called week before last by an individual who wanted some advice on what to do, because the individual's family member was a employee of Starbucks, and the Starbucks notified that one of their employees had tested positive, and so then they notified all the employees and called them, and we're able to narrow it because of knowing about how the transmission occurs in the exposure, as opposed to one cook in the kitchen or someone who's handling a lot of food that'll go out to many, many different people, right? So.
So the follow-up on that would be the recent news, and it's going to take a second for me to couch this, but the recent news about the bar in a different state, and there were several people standing in line, and basically the contact tracing had shown that 85 cases resulted in people standing in line waiting to, either they themselves were waiting in line to get into the bar or they took it back home, but it was 85 people that were associated with that particular line. And so that made the news. And when we were been having these topics of discussion, one of the, and this I guess kind of follows up on Councilmember Scanlon's, some of his concerns, but another way to look at this might be that if it's about trying to get businesses to comply, if they are just absolutely adamant that they are anti-mask because my right's my right, we also expect as consumers to have notice as to what stores, what health risks are associated with different things, whether it's on a Surgeon General's warning on a pack of cigarettes or any other thing that, we constantly are being given notice. So if we were to decide to take a route of, okay, fine, if business owners, you're going to get to decide if your store is going to be a mask required, and that would be posted on the front of their store or restaurant or church or whatever this is, or this is a no masks required. As soon as you cross this threshold, then you are going to be, whatever dangers you might consider are associated with that, that's your choice. If we were to do that, can you explain, this goes back to the 85 cases, they were able to prove that because they looked at the virus signature. So as we know, there are slight mutations that happen from one person to the next, and they are able to know with very good accuracy where these people, what establishment would have been responsible for the picking up of these cases. So should they choose to not do a mask policy, but the virus signature tracing goes back to that particular establishment, I don't know what that would mean as far as at a bare minimum, the community would know. That name of that bar was all over the news because it was, if you were also there, you might be in positive just like these other 85 guys. So sometimes rather than pushing a you must do this, understanding that the consequences, freedom has consequences as well. I mean, it comes with great responsibility. And so if we decided that we wanted to do it for a notice standpoint, can you explain to the public how those virus signatures work and how slight the mutations are to be able to identify a family line of cases? Without getting full on into the weeds, I understand, and you're muted.
No, I'm not a virologist, but I would say everything you say is scientifically reasonable to think. I think the level of sophistication in science, though, to genotype those viruses is very high. Okay, and that has to happen doesn't happen in a run-of-the-mill lab at any hospital. That has to happen in a highly specialized lab with very serious equipments and scientific. And I don't think it would be feasible to apply that on a broad basis to
Yeah, I'm thinking
to
more like
sequence. Yeah,
what
but
you
I think that was a research project to really show, you know, to prove definitively that these kind of interactions do transmit, right? And the idea of super spread, that's a super spread event. Lineups are bad things. So, but you know, to your point,
discovery is what
pardon?
I'm saying. They're showing up in discovery from
Yeah.
lawsuits.
Yes. So one of the things that you might want to engage in is, you know, to capitalize on people choosing. And so by and large, so there are people who are developing apps that are designed to rate businesses on their COVID. So you go to a restaurant and then you put into the app and then you say, and if enough people go there and say, well, the staff were wearing masks, the tables were socially distanced, they didn't have these lineups, they had all these things, they check a list of things, and then that becomes a resource for people to look at and say, well, we're thinking of going out to dinner, but we want to be in a COVID safe place. Let's look what it kind of like looking up the food inspection report on a restaurant, right? But there are still then the segment of the population who are just ignoring this regardless, you know, and that's the challenge for us. It's that group and who just say, you know, I don't care, I'm not going to get sick, I'm, you know, going to do this. And I saw this on some of the interviews of people waiting in line at the BOK Center, where they just said, I'm not concerned. So,
But the BOK Center was concerned because they didn't want to be sued for that.
of course. Well, actually, the BOK Center,
offer these
yeah,
options of notice, and a business blatantly says, I want my customers to have the choice. Well, as soon as you've decided to make that choice of it's a free for all, as soon as you cross this threshold, then the burden at that point, they've openly made a choice that they're allowing the risk inside their establishment.
yeah, yeah. Unfortunately, I think you're right. I think lawsuits will move forward. They'll take time, right? And you know, they probably won't all be worked out in time to be useful to us before a vaccine is available, right? So, but I think you're on a good point. I mean, the legal suits will be part of the thing. I think if I was to conclude from what I'm hearing, though, I think getting business to really be compliant with this, every business, whatever, with masks, or making some type of orders on that if you have to, would be a good step. And then I think for the broad public, it's going to have to be a very stepped up educational effort. And then I think in that educational effort, we're going to have to tap into some people who were of the opinion, oh, this is not a big deal, or I'm not going to get sick or whatever. And then who did have an experience of a close family member or something to say, well, what do you think now? You know, after you've got it, and bring them into the education. But no, I think taking some steps with the business community and requiring, wherever there's close interaction of people, requiring masks will be helpful.
Okay.
Councilmember Bierman has her hand up.
I think I remember my question. Yes. Oh, okay. It's been a little while. How do we confirm, or how do we empower businesses if someone states that they have a physical or mental reason to not wear a mask? Where do the bounds of ADA and HIPAA laws come into this? I know there's a lot of probably inaccurate information all over social media about this, so just want to be clear on what the guidelines are.
Definitely, if we adopt a mask mandate, I would want some exception for disabilities. I don't think you want to put a business in the position of asking. In fact, we can't ask about what the disability is or anything like that. You have to be very careful about those things. And so there would have to be some kind of exemption for disabilities, certainly.
Okay. I would at least like to make sure that whatever we do decide, that we're able to put together some information to be able to share with businesses about what their legal limitations are and being able to ask for it, especially if there is going to be any kind of enforcement action. It would be good to know and have for businesses be available what their legal responsibilities are in terms of asking or not asking. So I know that everyone's fairly used to it when it comes to service animals, but it never hurts to make sure that information is readily available.
Mayor, I don't see any other council comments right now.
Excellent, because that seems like a wonderful opportunity to call on our fourth speaker for the evening, Norman Chamber of Commerce CEO and President Scott Martin. We had a meeting last week with some business owners from a variety of industries in Norman, and we had one a while ago, kind of didn't need it, and now we're having conversations again. And so, Mr. Martin, you've got to hear a lot of concerns and questions, and I don't know how you want to tackle some of that, but I appreciate you being here tonight.
Thank you, Mayor and Council. Yeah, it's timely considering the kind of some of the recent discussion that just took place. I point out to begin with that when the virus first hit and the first rounds of restrictions were going into place upon businesses and the rest of the community, those businesses that were able to remain opened, they complied with the regulations. I think in the vast majority of them did. And as Dr. Raskop pointed out earlier in the conversation, that was when we were having 0 to 1 to 2 new cases a day. And during that time, I don't know about you, but when I did get out and about, which wasn't often the first 2 months of this pandemic, most all the businesses I was going to, their employees were masked up. They had social distancing guidelines that were within their business, lots of sanitation recommendations and guidelines that were posted around their businesses. So I would just begin by saying that I think the vast majority of businesses throughout our community are wanting and doing the right thing. And then I think there's been generally broad acceptance of the CDC guidelines. Yeah, sure, there's not, you go around the community, you don't see 100% compliance, but most of them, most businesses, you see that in. I even heard recently that about 50% of the workforce is still working remotely. So you find a lot of office settings are still allowing their employees to work remotely as they can, which is great. I know that was one of the early recommendations, and that's still in place. I would point out just a few concerns that have been brought up to me throughout the last week or 2 conversations, particularly Mayor, in our meeting last week. We have a lot of employers. Let's think about restaurants, retailers. They employ relatively younger people. And as we were discussing earlier and hearing about, they are concerned about their employees becoming infected and then bringing that into the workplace. So they have the same exact concerns you do, more specifically related to their business. I heard similar concerns related to our manufacturers. We have multiple manufacturers around town who employ hundreds of people. They have very stringent guidelines in place, and their biggest concern is not what's happening within the work site, but rather what's happening when their employees go home and get into the community and interact with people and potentially become part of the community spread. So I know that's a big concern. And then probably lastly, the overriding theme that I've heard from every business is that they're willing to step up and do the hard things because they don't want to be shut down again. That's their biggest fear right now is being shut down, being closed, and not being able to operate. From day one, the chamber, and I know a lot of other businesses too, but in particular, we have been very strong in promoting masks, social distancing, washing hands. We've been part of those campaigns. We've had posters and paraphernalia links on our website. We put out there. We've even offered for free some back to work kits for signage and things for businesses. And we are currently working with the city and also Visit Norman to create a new Mask Up campaign, something that's a little bit more reflective of where we are currently, and probably a little bit more specifically as everybody starts thinking about getting back to school, the university football. We're going to try to hone in on those themes and hopefully touch people and impact people where it counts. But we certainly want to be, part of the solution. And I think what you're seeing amongst most businesses is that desire to help out and not, not be part of the problem. I will say 2 issues or concerns that, or a couple more, is one, the enforcement issue, which was brought up earlier. Some businesses are concerned about that falling on them. It's not often that there's many city ordinances that you would say that you would encourage people or businesses to take the law into their own hands. And so that's an issue. It's been brought up to me many times. And then also the access to masks. Some, not all, but some have expressed to me a concern, not so much for their employees, but if they were required to have masks at the front door for their customers as they come in, as opposed to the customer having one with them, and how they can gain access to those, and then probably more importantly, afford them, because we have a list that's out there of businesses, local businesses who are selling masks. But I think the bigger issue is just the cost. So those are some of the concerns, and I'd be happy to engage in dialogue or questions, try to answer any questions you might have.
Thank you, Mr. Martin. Yeah, one of the things that I think we had talked about in terms of enforcement, everyone brings up what happened in Stillwater, and nobody wants to put their employees in that place. But I'd love to hear from Catherine, our city attorney, on this. So with the no shirt, no shoes, no service, we can refuse service to anyone. Wouldn't this essentially fall into that category? Or pants? There you go, pants, like Councilmember Wilson had pointed out.
Yes, and those signs don't necessarily arise out of an ordinance. Of course, we have an indecent exposure code provision, I suppose, that could have come into play if you walk anywhere in public without pants on, but you could go somewhere without a shirt and you're not violating a city ordinance necessarily. So those are typically business policies, I think, that the businesses have chosen to enforce. I don't think it's necessarily a city ordinance. And looking at several of the cities that have recently required face coverings, there are some that put completely on the business, but most of them are requiring businesses to post signs and things like that to encourage people to wear them, make them aware of the requirement to wear them when they come into the business, rather than putting them in the shoes of the enforcer.
And so in that scenario, like if I was, I don't know, working a retail store and someone came in and I said, oh, there's a sign, you may be aware of ordinance 372, you're going to have to wear a mask to come inside, and somebody started harassing me or threatening me, that's when the police would be called in that scenario? Because I think everyone's not mentioning the police, but that's what we needed. When does that come into play?
Yeah, the police are the enforcer of our ordinances. That's who would typically write a ticket. I know in some cities, Stillwater's considering theirs next week. I think they're looking at, in those situations, it would not be a ticket for failing to wear a mask. It could be disturbing the peace or something else. where you're refusing to comply. But that's a difficult thing for our police department to try and enforce. So I think the keys there are, like I said before, education, but also making sure masks are available. And so what I'm seeing in a lot of these cities is along with the ordinance, they are appropriating some amount of money, ranging from very little to a lot, to provide masks so that businesses can come pick them up and provide them to their customers.
That was my next question. How is there any CARES funding available where we want to be able to access the money that's supposed to be coming to communities to manage COVID-19? If facial coverings are what the science and medical professionals are telling us, it would seem quite logical that this would fall under some sort of reimbursable expense. Where are we at on that? Because I agree, I want to help support businesses and nonprofits and everyone in making sure that we're doing our part to keep residents masked up.
I don't know if Chief King.
Oh, yeah, go ahead, Chief. Yeah.
Yes, Mayor. We checked with Oklahoma Emergency Management on that. There's kind of two avenues to try to get reimbursement. OEM would not, they said that is not a reimbursable thing. We're still waiting on an answer from CARES. We have reached out on that side as well, and we have not gotten an answer yet.
So if we
don't, I think that would be a great idea though, because look, I have a box of these on my desk just over on the corner. I mean, these are cheap, and I think if you can order them in large amounts, and I think if you were able to provide these to businesses and they were able to simply give these to customers who came in who didn't have it, that would be huge. That could be very significant. I mean, Daryl, look into the camera. He's modeling it perfectly now. Having those, I mean, and these are effective, no question.
We like many businesses, we took the initiative early in our offices to purchase them for our staff, not the disposable ones. And then just this week, we have taken the step to buy a box of the disposable ones and just to have them on hand for people that drop by. And that's from a local business. I know local businesses have them, so I'd encourage, if the city were to purchase a large quantity, one of our local businesses to get them from.
Okay, you have some hands up, Mayor. Councilmember Wilson.
Bill and Jumpy, I want to jump in here. You may or may not know, but we own several businesses. Kate Behrman and myself do. And we have had various stages of closing and opening, and we've got food, we've got dogs, we've got all kinds of scenarios. And what we did early on was we put a basket of homemade, their cloth masks that our employees made during our closed times. And those are in baskets, free to a good home for anybody that doesn't have one. And we've had very little pushback. We just simply said to come into the business because we have immune compromised people that work for us. And mostly with the dog situation, we weren't certain how, that transmission might or might not affect dogs, and dogs to people, people to dogs. We weren't sure. So we just said, mask everybody, don't come in our lobby. We'll come out to you. And that's not been that difficult. We've lost a few customers from it, but it really hasn't been that difficult. I'd rather do that than close my business again. We cannot, I feel for the businesses, we just can't keep closing and opening. So we need to figure out a way that we can operate in this world that has this unfortunate virus rolling around in it. In the restaurants, we have had very little pushback, but it is kind of difficult to come in and sit down and drink a cup of coffee with a mask on. So there's those moments of having to have it. But for the most part, most people have the masks at this point. I think we're beyond that. Not to, contradict anybody that's having a different experience. But I would like to see masks being given or distributed somehow in our community or at the businesses. And so that's my input on that. As a business owner, I'm happy to require masks if we can stay open.
I think that's been the general sentiment from most of the people I've talked to. And that's been my personal experience as I have visited businesses, whether it be retail, restaurants, office spaces. Most of the employees are masked up. It's the customers that I find to be the least compliant.
And just a quick note of our experience, we have had some people push back pretty vehemently. So if the city had an ordinance that actually helps us say, I'm sorry, the city of Norman says we have to do that, you know, even though we've made it a personal choice, it seems to validate that, and it helps us. And I think it would help the whole city, the businesses, be consistent in those kinds of, because that's where that community contact is happening. It's in the businesses. It's not happening at a park or in your home generally, other than maybe, you know, house parties or whatever. But and so I think that would actually help businesses have some, you know, I don't know what you call that, backbone or something.
I'm glad you mentioned that, Councilor Wilson. I don't know about all of you, but I have received several emails from business owners asking for that. They're asking for, please help us keep our employees safe and have this requirement, give us something to point to. So I completely agree with that. Who's next, Madam Clerk?
Councilmember Patron.
Hi, Mr. Martin, how are you?
Good, thanks.
Good. I actually feel like I read a article of yours here recently in the paper, but anyway, and I guess following up on what Councilmember Wilson just spoke about, from the conversations that you've had with the many businesses that you represent, do you feel like, and this kind of circles back to the liability conversation that we were having before, that it would be, most businesses would find it helpful to be able to say there is a mandatory mask policy in Norman. So this also helps me as a business owner to be able to not have to worry so much about the liability of not requiring masks in my establishment.
A couple things to consider is that one, certainly not everybody's going to be on the same page or agree, and I don't need to tell you all that. You hear often the diverse viewpoints that are out there. But in general, my conversations with business owners have been such that they would like to see more general compliance. And I would point out that, and the mayor was very quick and right to point out last week in our conversation that much of our healthier at home and reopening phases and things have required masks. And so our businesses, as I mentioned earlier, were pretty quick to comply with that. Yeah, yes, there's always outliers. I get it. We heard about those early on in the process, but in my experience, and I would think yours is the same, we heard from Councilor Wilson with her businesses. She has the tack that she's requiring her employees and I guess her customers. And so I think most are doing that today. And I've heard from retailers who are doing that. Of course, restaurants, you go out to a restaurant, that's the case. You go to large retailers, you see it there. Some offices, depending, I guess, on how they're able to social distance. So I think they would like a little bit more reassurance as far as community, community consistency. But again, and I've heard from some who have had signs out that have pointed to them and said, hey, look at my sign. If you don't want to follow this, then please go somewhere else. It's just that when people get a little out of control, I think that's a concern. And I don't know that that's going to happen, but we've heard about that from other communities.
Councilmember Bierman has her hand up.
Sorry, I was asking a follow-up. It just muted.
Okay. You're frozen.
Can I be a little bit more direct and ask, would we have the chamber's support in a mandatory mask policy in the city of Norman?
Well, again, we've been pushing and encouraging people to wear masks from day one. It's been part of our promotion, advertisement, suggestions. If you numerous of my videos, every single one of them have ended that way. Wear a mask, wash your hands, social distance, be safe, be healthy. I don't think you're going to find mass opposition from us or other businesses. Like I said, our biggest concerns are the enforcement issues and then the availability of masks and the burden that can cause to businesses. You all are very aware that the hardships that many of our businesses have gone through in the last 3 months, and to add another financial burden on top of them while disposable masks are not expensive by any stretch, they are a cost. And for some that are just struggling to get by right now, that may be too much to ask. So if you're going to put this on them, I would just ask that you provide some assistance and help to help them get through that.
So I'm incredibly supportive of, helping to supply some masks. And so if we were to, I'm going to ask it one more time. If we were to supply the masks, sorry, my husband's. If we were to supply some masks, can we feel confident that the chamber would be supportive of a mandatory mask policy ordinance in place for customers, employees, et cetera, unless you fall under the ADA exemptions, obviously.
Like I said, we've been encouraging it from day one, and the majority of our members and businesses in general that I've spoken to have been supportive of wearing of masks. So I don't think you're going to find mass opposition to it. There are some, like I said, not everybody's in support of it. I've talked to them, you have too. But in general, most of them are supportive, and we've seen that in the way that they've operated. These businesses are operating correctly. They've been operating within the guidelines. And many of them, like Councilmember Wilson's business, not many, some that I've been in, they have provided masks to their customers if they so desired them when they walked in. So I think you'll find pretty broad acceptance from businesses across Norman.
Great. Thank you, Mr. Martin.
Councilmember Bierman.
Now I'll go. Well, I will say that Councilmember Petrone asked the question that I was going to ask, which was a straight yes or no. And I will point out that, the additional, as we can see from the sheer lack of disinfecting and sanitation supplies at all of the local grocery stores, that everyone is having to do more purchasing in this area than they had previously. And we can tell because there is limited stock. So I would put this in the exact same category, that if businesses want to open and want to be safe, then this is a cost that they should be taking on. But for anyone who doesn't follow the Shop Safe Norman page, it is very, very clear that there are a large number of businesses in this community that are not complying. If Ellie wants to come and say hello as well. So come here, kid. Sarita, Ellie wants you to know that she's playing with her Magnetiles. All right, go play. So, where was I going with this? Shop Safe Norman. There are lots of businesses that are being reported as not being compliant with even the recommendation to wear masks. And so I know that this is a bigger problem in this. If the data wasn't already showing that this was a bigger problem in our community that personal and business responsibility would take care of, then I think that the reports from customers, from Norman residents on these pages would show that to be the case. And I would imagine that probably not many of them are chamber members because, as you have mentioned, Mr. Martin, you've done a lot of work through the chamber and with your businesses to work on that. But we do have lots of businesses in this community that are not adequately protecting their employees or their customers. And so, I feel that if we can provide masks, we should. I know that Crest has them every single day for fairly inexpensive. I know Sooner Pharmacy always has them, at least they did as of a week ago. So, there are places in town where they are easily attainable, also online. And so, I think that this is the kind of thing that would even encourage more people to go out and start shopping or, patronizing the businesses of Norman, because they will have better reassurances that at least the city is doing everything they can do to ensure compliance with the measures that we know will mitigate the spread of this virus. So I think that it is appropriate for us to look into buying PPE, or not PPE, even just surgical masks. I'd like to stay away from talking about the actual medical PPE, but this stuff is available, and if we can provide it, we should. But I think that I personally think that we should be proceeding with a targeted mask mandate, maybe with a specific goal in mind, which we did with our Healthier at Home initiative. But I see very few hurdles in trying to make this as effective as possible with as little impact on businesses as possible as well.
Okay, Mayor, I'm not seeing any other hands.
Okay, well, to wrap up this topic, after looking at the community input and hearing from all of our speakers and from all of you, I will be asking city staff to put a mask ordinance on Tuesday's agenda. And we ordinarily don't have any sort of votes like that on swearing in day, but I think we are there and it's time to act. And I think since this is not going to go away in the near future, emergency orders can only do so much. And I think this needs an ordinance. And so that is the direction that I would like to take this in. And I appreciate everyone's feedback today. And hopefully we will be able to do something comparable to what our colleagues in Stillwater are looking at. And again, I'll point out, college towns are being very proactive in this, and I think there's many reasons for that. But I appreciate all the discussion tonight and the dialogue, and to all of our guest speakers. We had a nice kind of spectrum of different ways to look at that, and all of the feedback was very, very helpful. And I will also ask City Manager Pyle, I don't know if it's, someone had offered to donate money to buy masks for businesses, but we need to see what we can find and where we can get it, because I would think that cities can get it bulk cheaper than I think your average Joe could. So I'm all for that. And I know that some cities have used, fire stations. Go to Fire Station 1 and pick up your initial supply of reusable masks. And I would ask, in whatever ordinance we draft, we put in there something that gives some wiggle room at the beginning of it, as we're all trying to get the masks to hand out to people, so we can be flexible in meeting the needs of our businesses as well as that of the ordinance. All right, with that, we will move on to the next item on our agenda. Item number 4, addendum number 1 to contract K 1819-146 with Mr. Daryl Pyle, increasing his compensation for employment with the City of Norman as city manager. I'll entertain a motion to approve or reject the addendum.
So
moved. Second.
Are there any questions from council?
Second.
Thank you, Councilmember Carter. Are there any questions from council regarding this motion?
I'm not seeing any questions, Mayor. Oh, wait a minute. Here comes a hand up. Councilmember Holman.
Would we maybe like to give most people don't know how the process of hiring a city manager works, or the contract that's involved with it, or that the city manager is the only employee of the city council. So maybe we could have some explanation about why we're doing this right now, and just maybe help clear up some of the confusion and even some misinformation that I've definitely seen about this particular item.
Thank you, Councilmember. And I would add to that also kind of the why we're voting on it on July 7th. In addition to tonight, given that this is the only council that has worked with Mr. Pyle. So I don't know who wants to take that, but go for it.
Okay, so.
Thank you, Catherine. I was going to say, Ms. Walker actually drafted agreement. So thank you, Catherine.
So you are correct. The city manager by charter is the only employee of council. He's hired by contract, but the charter also requires that his compensation be adopted by ordinance. And so the item you see tonight is just an addendum to his existing contract. You all had the executive session last week and then directed me to draft a contract addendum that reflected the feedback from last week. And so that's what you see before you now. Nothing else will change in the contract. It's just the base compensation, and it's being done now for a couple of reasons. His contract requires an annual evaluation. He's coming up quickly on his 1-year anniversary, but also because you all are the only people that have worked with him. So to ask new council members to evaluate a city manager they've maybe only met once for orientation is probably not a fair thing to ask of them. So you have the contract tonight and first reading of the ordinance that sets the compensation. Next week, before the new council members are sworn in, you'll have the second reading of the ordinance setting his compensation. And that's just a formality we have to do because of that charter provision. I think that answers the questions. So let me know.
So tonight's the first reading and next Tuesday would be the final vote on that.
Yes, and I will own my mistake. The original agenda that got pushed out had an error in the title. Last year, we adopted it by emergency, the ordinance, because we wanted it to coincide with his start date. Right. But here, we don't have that. He's already here. We don't need to do that. So that was taken out of the ordinance, but not the title, my fault, and that's been corrected.
So there is no emergency clause.
That's right.
Because I did have several questions about that, why the emergency. Well, I appreciate that explanation. I was even a little confused about a month or so ago because just in all my time on council, the manager's evaluation has always been in March or April. And I didn't really know what reason. I was talking to Brenda earlier this afternoon about it, and she said that Steve Lewis was hired in the fall, I guess. And so it wasn't necessarily connected to that, I suppose. So, but I was a little thrown off by the scheduling of it. And I was actually starting to wonder when we were going to do the evaluation or not. And I knew that the city manager being our only employee, that his contract was coming up and we had to make some decision on it. So I do appreciate that. Is there anybody, Anthony or somebody, that could talk about this particular number, what the city manager's pay is compared to other cities around us that we compare to?
I have that information.
And before we dive into that, Councilmember Holman, I will also tell you that Madam Clerk was poking me about this for at least the last month, and we've had our hands full with a couple big issues. So yeah. I'll own that one for sure.
And Your Honor, Councilmember Holman, interesting point about the date in the agreement. Happy to back up the date of the evaluation. If we want to look at March, I want to make it easy for you. And as long as we're consistent and we establish March, April, whatever works good for council, works for me. So if there's a date you think it's easier between, swearing in and budget adoption and all those dates, whatever date council decides will be our next annual evaluation, we'll just move that date and that'll be how we go from this point forward.
I mean, I would think that in springtime, March, April, or May, probably the April or May would be the best. I mean, July is probably the worst month to do it, since you could have 4 new council members potentially, not this year, but in any given year, and they wouldn't have ever worked with the city manager. So, yeah, I would definitely encourage in the future we do it in the March, April, May time period for sure.
To answer your other question about where the number came from or what information you had, our Human Resources Director, Gayla Hicks, shared with council a survey of benchmark cities, benchmark cities, similar cities to Norman, and those base salaries. We are next to last for the city manager in that list, which puts the salary at about 23.6% below market. So this increase will not put Daryl at the top. It's going to get him about midway point. It will not get him up to average. He'll still be pretty far below average. So there's that.
Okay. Thank you. I appreciate the detailed information, Catherine and Daryl. That's all I have right now.
Okay.
Basically, we got Daryl for a steal. His first.
Okay, have Councilmember Wilson and Bierman. So Councilmember Wilson, I'll lower your hand first.
Thank you. I think that was my question, Catherine, was the comp cities and how that, I've gotten a lot of questions about the so-called cut to the police budget, but increase to the city manager's budget. And so I guess maybe Anthony, how do we generally budget the city manager's compensation? I mean, he prepares the budget, you prepare the budget. We don't always know what that raise is going to look like, or what, like, so did we prepare for this type of a raise? Is it in the budget? I guess is my question.
We would prepare for this in the same way that we prepare for cost of living adjustments across the board for any of our non-union or union employees that report to the city manager. Within the appropriations for the various funds, like the general fund that the council has appropriated money, where we would have money within those appropriations to cover whatever the salaries are, whether we budgeted for them at that level or not, we will cover that from within those appropriations. So for example, last year, fiscal year 20, we did not budget a cost of living adjustment for any of our employees, but we gave like a 1.75% increase. And that was just absorbed within the appropriated money the council had given. So the setting of salaries for employees that report to the city manager is up to the city manager. The setting of the salaries for the city manager is up to the council, but how it gets covered within the budget is just within those appropriations.
Okay, so I have another question, and I don't know how to delicately ask it. And I'm really good at delicate questions. Past city managers, when we've hired them in, like Steve was here for what, 9 years or something? 11 years. So when he was hired in, did he get hired in at a rate that was anywhere near area cities? And then as he got raises throughout his tenure here, how did those generally go percentage wise? And I know that you might not have that on hand, so just anecdotally is fine by me.
If that's directed to me, it's really, I would be kind of trusting my memory to the best that I can. But as I recall, Steve Lewis was also hired in quite a bit below market level. Did get raises that sort of approached him toward the market level, but he was also still below market wage and total compensation throughout his tenure.
Okay, thank you. I just wanted to, I know that I was part of the team that helped with hiring Mr. Pyle, and I know that without divulging too much of our executive session times, that we had a lot conversation about getting the most bang for our buck without being able to, you know, sorry, Daryl, I've appreciated every minute of you being here. So, and so I know that this raise is getting some pushback in the community because of some of the other things that have gone on, but I really, I hope my fellow council members can support this because of how it came into being. That's it. It was a statement, not a question.
Okay, we have Councilmember Bierman.
So I feel, oh, sorry, I got to hold my microphone because otherwise people can't hear me very well. I feel a number of ways about this, and I want to first off acknowledge that, not that, I mean, I wouldn't say that I've come 180 degrees on it, because I've spent a lot of time with Daryl and worked on a lot of things with him, and I have appreciated the creativity and forward-thinking perspective he has on things that I have at the top of my ain't never gonna happen list. And he has actually made some headway on those in ways that I wasn't expecting. I think that he has likely saved this city a lot of money in very invisible yet still entirely important ways. And at the same time, I don't know that I will ever make as much money in a year as we are even currently paying Mr. Pyle. I know that there are a lot of people in this community, and particularly in my ward, who don't even make in a year what we are considering in terms of a raise. So that kind of shows the kind of polar opposite feelings that I have on this that are very, very difficult to reconcile. I also want to acknowledge that the last 30 days has felt, I think, to a lot of people in this community like a disappointment in terms of how council has or has not acted on issues that matter to them. Rightly or wrongly, everyone gets to make their own subjective determination of whether or not that is the case, that there are a lot of people who feel that way. And so this has probably been one of the more difficult decisions I feel like I've had to make in the last few weeks. I feel like some of them have actually come easier, and they have been bigger, more impactful topics than this one. So Daryl, I believe that you are worth it. I also believe that there are a lot of people in this community who are weighing all of the variables that I have voiced differently than I am. And so I think that there are going to be people who don't really care about this vote that we're going to take partly tonight and partly next week. I also think there are going to be a lot of people who feel very strongly about it and feel very strongly opposed to it. So yeah, I mean, I don't really have a question. I just wanted to put all of that out there. You know, I think that some of the critique has been fair. I think some of the critique has been unfair. And just know, I want everyone to know that no matter how I vote tonight, no matter how I vote next week, Mr. Pyle, I'm going to be holding your feet to the fire about all of this stuff with NPD, about mask wearing, about addressing the systemic racism that many people in this community and I have come to learn is inherent in police departments, not necessarily ours specifically, but generally, and possibly in ours specifically too. I think that's what some of these investigations are aimed at looking at. So no matter how I vote on this, just know that that's not a pass. It's not a pass on these very, very important topics that are not only critical to the city, but of particular importance to my ward, because I do have some of the lowest income census tracts in the whole city. So I do want to put voice to the concerns that people have been sharing with me. I don't think I have ever gotten an email about the city manager's pay raise before. And I've gotten a lot of them in the last few days on this. And, you know, I've read each and every one of them. I'm sure I haven't responded to all of them yet, but I have read every single one of them. And I want everyone to know that I take their perspective and their thoughts on this very seriously. No one ever weighs everything the same, and council members included. So I'm going to leave it at that no matter how I vote tonight, it's not a pass on these topics that are still ongoing, that we're still working on, and that we still have to tackle. So I think you're doing a great job, Daryl, and I will commit to ensuring that you continue to do a great and even greater job in the future.
Thank you, Your Honor.
We have Councilmember Hall. You're still muted, Councilmember Hall. Hang on.
Okay. Sorry. I just wanted to say that I certainly understand where Councilmember Bierman is coming from, and we have had a lot of input on this in the last few days, which I think we're all very, very sensitive to. But I also feel like, you know, we have an evaluation process. We have proceeded through that evaluation process, and we have to take into consideration the performance of City Manager Pyle for the entire year that he's been here. And there are certainly multiple categories that he has excelled in. And, you know, we've touched on some of those. And so I think we need to take that into consideration too. I wanted to thank Ms. Walker for clarifying a lot of what I think some of the misinformation is out there about the process, and particularly the emergency clause. That's been a source of a lot of comments. So I'm glad we've got that cleared up. And I also want to just revisit the whole idea of how we try to establish appropriately compensating all of our employees in Norman, including the city manager, and the fact that he is 23% below even the current, you know, market value of city manager positions. And so one of the things I also wanted to clear up, because this has come up, I don't have the chart in front of me that we had access to. And so if I could, I don't know if this is for Mr. Francisco or for Ms. Walker, but I also wanted to point out that we are the third largest city in Oklahoma, and there are other cities in Oklahoma that are smaller than we are with a lesser population that I believe their city managers make a higher salary. So I believe one of those is Stillwater. I believe another one is Edmond. I believe another one is Lawton. But that's off the top of my head. So I didn't know if we could get any confirmation on how other cities in Oklahoma that we use as peer and benchmark comparisons for all kinds of things, how that salary level stacks up with other communities in Oklahoma.
Sure. In the salary survey, we looked at a number of cities, college towns, things like that, but cities of similar size in Oklahoma, Broken Arrow, Edmond, and Lawton. Broken Arrow and Edmond both pay more by $20,000 and $26,000 a year. And Lawton, I said we were next to last, Lawton's last.
Oh, okay.
Yeah.
And what about Stillwater? Was that part of it?
It's not on there.
Oh, okay, thank you. So even as we consider this pay raise, would he be at the median level?
No.
So he'd still be below the median level.
He'll be more than 12% below average, and I didn't figure up the percentage, but about $10,000 a year below the median.
Okay. Okay. Thank you for that.
Okay, I don't see any other council comments right now. Mayor?
Councilmember Carter wanted to make a comment.
Oh, okay. Go ahead, Councilmember Carter.
I just think very rarely in life do you, I mean, frequently you get what you pay for. And very rarely in life do you get more than what you pay for. And if there was ever a circumstance where I felt like we have gotten more than what we've paid for, it's with City Manager Pyle. I think he's done an outstanding job through just an unprecedented time in history, unprecedented budgetary issues within the city for numerous reasons. And he's navigated that course with an expertise that I just find astonishing, honestly. And I was advocating, you know, for him to actually have a bigger raise. And so I'm very, very comfortable with this. You know, there's certainly to make him equal to the city manager, Broken Arrow, I think would have been reasonable. The complexity of Norman is far greater than than Broken Arrow. And so using that as a benchmark alone, just within Oklahoma, makes me feel like he's still deserved of more our gratitude. But I'm very comfortable with this. I hope the rest of council is. I just don't feel like, I think this was one of those times in history where two paths have crossed, and it's been a symbiotic relationship, and we need to make sure that it continues into the future. Thank you.
Okay, Mayor, I'm not seeing any others, council comments at this time.
All right, thank you. This is an opportunity for members of the public to address council on this item. Are there any public comments on this motion?
We do have quite a few public comments, Mayor. I will start by reading some, and then Annalise will read some that's come in through our YouTube feed. This comment comes from Christina Otis. She is writing to urge Norman City Council to not support a $25,000 increase to already highest paid city employee, City Manager Darrell Pyle's salary, as it is being decided upon in this evening's meeting. I stand with Norman Citizens for Racial Justice in calling the Norman City Council to stand with us in calling for, number one, that money instead be used to fund community mental health and well-being initiatives, adding it to the $800,000 plus that is being reallocated from the Norman PD. And number two, City Manager Darrell Pyle answer immediately as to how he will hold NPD accountable for the ample evidence of racist and misogynist practices that he is well aware of, as Norman Citizens for Racial Justice presented it to him in June 9th meeting. This evidence includes the testimony by former MPD officer, the utter lack of accountability nor transparency in the case of Officer Jason McDonald's racist hate imagery, as well as current MPD officer inciting violence results in threats and now acts of violence in the form of rape because of his circulating on social media councilperson Scott's home address, as well as police report of her own sexual assault cases years earlier. We will be watching the session this evening and urge you to do the right thing. Thank you for your consideration of these items, and thank you for your service. And the next comment comes from Michael Graff, and he from Ward 6, and he writes, I oppose any salary increase at this time for the city manager. Metrics such as lowering police violence and mask wearing for the police should be used to drive any salary increase. Until performance is shown in key metrics, no raise and no renegotiating contract. The next comment is from Susie Hurt. And it says, how can this increase be justified given the financial situation? You can meet contract by having evaluation, but don't have to give an increase. This is happening in many businesses today. Great performers, but no raises due to financial situations. Sends the wrong message to all citizens. And I believe that's all I have through the email. Annalise has several to read from the YouTube feed. Annalise.
Yes, we have gotten several comments in from the YouTube. I will read them. Randy Studley, Ward 1, reject the salary increase for City Manager Pyle. His complacency is unacceptable in the face of racism, misogyny, and corruption. Bobby Chambers, Ward 4. Do we get to hear why or how Mr. Pyle earned a raise? Is the evaluation open to the public? Amanda Wilson, Ward 1, no mask, no raise. Matthew Cooper, Ward 6. I also do not support an addendum for a salary increase. Bobby Chambers, Ward 4. I am open for giving him a raise, but would like to know more about the valuation of his work. Ward 1, Hannah Smith, reject the pay increase. It is ludicrous to award this already well-paid public official a raise in the middle of such a crisis, nor has he earned one. Megan Stronghen, Ward 2, City Manager Pyle has been briefed about issues related to racism in the MPD and has not responded adequately. I ask that any raise be postponed. Richard St. Dennis, Ward 3, I do not support mandatory masks and a hard no on pay raise for city manager.
Ramona Beezus, Ward 6, no raise until claims of MPD racism have been addressed. Ryan Powell, Ward 4, no mandatory masks and none of you deserve a raise. Jill Hawley, Ward 4, no on the salary increase. Brandy Studley, Ward 1, you can't even raise Oklahomans minimum wage for years, but you want to increase his salary. Not okay. Stephen Ellis, Ward 4, surely it is possible to give the city manager an incomplete, given all of the live issues before the city. We can boost him on a few months if things go okay. Tia Tash, Ward 4, in the middle of a crisis when the poor are affected the most, reject the pay increase for someone already in such a high place of privilege. Sasha Clements, Ward 3, in 2018, the Oklahoma City manager made $154K with a population of 969,000. Norman's population is significantly lower than that. It does not seem like a higher salary is necessary. That's all the public comments that met the requirements for name and award related to this topic.
No other public comments, Mayor.
Thank you. Are there any final comments from council regarding this motion?
I'm seeing no hands.
All right, seeing none, the motion on the floor is to approve the addendum. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Carter.
An enthusiastic yes.
Councilmember Patron.
Aye.
Councilmember Hall.
Aye.
Councilmember Wilson.
Yes.
Councilmember Scanlon.
Aye.
Councilmember Holman.
Yes.
Councilmember Scott. Councilmember Scott. I'm not sure if she left the meeting. Mayor Clark.
Yes.
The addendum passes by a vote of 8-0. So it's unanimous.
Thank you, Madam Clerk. Item 5, consideration of ordinance 1920-68 upon first reading by title, fixing the compensation of the city manager as provided by Article 17, Section 1 of the Charter of the City of Norman, providing for the effective date for compensation to begin and providing for the severability thereof. I'll entertain a motion to adopt or reject the ordinance upon first reading by title only.
So moved.
Second.
Second.
Since this is a first reading ordinance, no comments or discussions will be made at this time. The opportunity for council and public comment on this ordinance will be at the July 7th meeting. The motion on the floor is to adopt the ordinance upon first reading by title only. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Carter.
Aye.
Councilmember Patron.
Aye.
Councilmember Hall.
Aye.
Councilmember Wilson.
Yes.
Councilmember Scanlon.
Aye.
Councilmember Holman.
Yes.
Mayor Clark.
Yes.
The ordinance is adopted on first reading unanimously.
That concludes tonight's special meeting. Thank you all to everyone who voted this evening, and continue to mark your calendars for future elections. August 25th is our next big one here in our community. And with that, this meeting is adjourned.